in mind, 93.9 WLVB. It's 8:19. Good morning. I'm Roland LaJoy. This month of May is Mental Health Awareness Month. And as we have done with the folks at Lamoille County Mental Health for the last many years, in order to highlight and bring to attention this month of May, as we invite folks from Lamoille County Mental Health from various programs to come in once a week during the month, and we started last week, and this morning Leslie Chilton is with us. She is with the ASAP program and with us this morning. Good morning, Leslie.
Good morning, Roland.
Nice to have you here this morning. So ASAP stands for, now you told me you didn't want to tell me in advance because it's a long, it's a lengthy name, but what does ASAP stand for?
Well, it stands for Alcohol and Substance Abuse Awareness Program.
Okay, all right. And as what is the program? I mean, obviously, it's kind of self-explanatory, but tell me about the program.
Well, it's grant funded. In 2010, the Vermont legislature passed a bill that was intended to start a bunch of these programs around the state. And Lamoille County Mental Health Services named its public inebriate program, because that's what they are, ASAP.
Right.
And so ASAP stands for that long name.
Right.
And also it does kind of stand for as soon as possible, because we're part of Lamoille County Mental Health Services Emergency Response Services.
Right. So, yeah.
So we're available 24/7.
Right. So what are some of the things that are under this ASAP? What are some of the things that you do? What are part of within the program?
Well, first of all, we have a 2-bed facility located in our old clinic building, which is right up by Copley Hospital. And one of the things that we do, the thing that the legislation really wanted to have happen, is we divert people from jail stays and hospital beds. And so that means that if the law enforcement, the state police, the sheriff's department, Morristown, Stowe, Hardwick police pick somebody up, and they've been incapacitated because they were using substances, alcohol and other drugs. Alcohol is a drug.
Right.
Then instead of trucking them off to jail in St. Johnsbury, if they meet certain basic criteria, they can stay with us. And then it gives us a chance to sit down with those people and find out what's going wrong in their lives, what's happening, and try and help them out.
So is that a bit like the diversion program that the Lamoille County used to have? It's called something else now, but is it similar to something like that?
Thinking of restorative justice,
right,
perhaps?
Exactly, yeah. Is it kind of similar like that?
We're part of what I would say is a community of care, so that we're another part of that whole community of care. Where if somebody gets involved with us, they've opened the door into that community, and we help them to hook up with other resources in this area. Right.
So is it a set program that they have to fulfill with ASAP?
No, it's not. What we do is we talk with people, we find out what's going wrong, what's important to them, help them to examine whether they'd like to change their relationship with their drug use, including alcohol, and what's going wrong, what obstacles they face, and then we do all kinds of stuff: motivational engagement, short-term case management, referrals, and then we will continue to work on a short-term basis with people.
So when they're done with ASAP, then they go to a different program that would continue their assistance, their help?
It's purely voluntary on their part, and we may refer them to our own agency for substance abuse and mental health counseling services and case management services. We may refer them to Clarina Howard Nichols Center. Probation and parole we work with a lot. The emergency department at the hospital calls us in many, many times. We work very closely with the excellent law enforcement community that we have here in this county. Family services, the social worker at the hospital calls us in many times. We work with behavioral health and wellness, the North Central Vermont Recovery Center.
Right.
Basically, anybody we can recruit, the better.
Based on the assistance they need.
Yes.
Right. So when this is all said and done, is there any will they have anything on their records? Does it expunge them from anything?
No. It's has
to help
no
them,
legal implications whatsoever.
Yeah, but it is to help them to get away from this habit and
Yes.
move forward in a lawfully way.
Yes,
Lawful way.
it's strength-based and strength-building.
Right.
And we have been so happy that people want to talk about themselves. We have no problem. We say to people, do you want to stay and talk? And they almost always do.
Right, because in a way, getting caught or this problem that they have, it's almost like they want the help, and this is their way of kind of getting it. I mean, to an extent, I suppose.
For
right?
some people, that is absolutely right.
Mm.
And one of the things that we've noticed over the 5 years plus 5+ years now that we've been in operation,
right,
is that people come back to us. I mean, people will catch up with me in the supermarket or send emails and tell how well they're doing, which means that it mattered.
right.
And
So
it's the ultimate compliment.
it is really, yeah, and to say, wow, you kind of got me back on the right path too.
And we do, we'll help people fill out an insurance application to Vermont Health Connect sometimes.
Right.
We'll sit down with them while they make phone calls. We'll help them if they want to go to a residential rehab. We'll help them sort out some of the complexities of other official things.
Yeah, and of course that also means they can come to you before something happens. I mean
Yes.
if they're really struggling right now, they can come to you now and say, hey, I want to get a handle on this.
It's interesting. The people that we work with come to us, as you might expect, from the law enforcement community.
Mm-hmm.
They contact us directly.
Yeah.
The hospital, both the emergency department and upstairs, I call it, inpatient.
Mm-hmm.
Agencies like my own agency and our emergency services program, our CRT program, et cetera, behavioral health and wellness, probation and parole, the recovery center, 12-step programs. Sometimes somebody will go to a 12-step meeting and be in trouble, and we've had people from there bring folks to come and stay with us, and that means they're getting them before they get behind the wheel of the car.
Exactly. That's ultimately what you want. Of course.
That's the ultimate prevention.
Right. And the group and the program is called ASAP. It is through Lamoille County Mental Health Services. And if you want to find out more, you can go to their website, which is lamoille.org, or folks can call as well.
And one other thing,
Yeah.
we are available 24/7. If someone needs our services, we have pagers, and they can call the pager number, which is 250-1447.
Okay.
And someone will call back within just a few minutes.
Right, because these kinds of problems happen day and night.
We'd like to help. If we may not know the answer to a question, but we will always do the work to find out where they can find the answer.
Get them to the right avenue, exactly. And then you can also go to the website again, which again is lamoille.org. It's the ASAP program, part of Lamoille County Mental Health Services, and it's during Mental Health Awareness Month. And Leslie Chilton with us this morning. Thank you, Leslie.
Thank you, Roland.
You're welcome.